With Walmart's new fresh and frozen subscriptions, you can save time on your weekly grocery shopping.
Dad, you're supposed to be grocery shopping.
And miss the chance to embarrass you in front of your friends? I subscribe to snacks and wet napkins. You know how messy you are.
Dad!
Walmart. Subscribe to your weekly list.
Hi there. You are listening to Raising Me. I'm Adrienne Stein, a longtime journalist and a mom of 3, and this is where we talk about the things that we're experiencing as parents and go to the experts for advice and guidance. This week, we are revisiting one of our most downloaded episodes, and it is one that really stuck with me, and I know a lot of us are worried about this and experiencing it as well. That is the rising anxiety rates among our kids. It's especially timely right now as mental health of young people is once again in the spotlight, with the top doctor in the U.S., the Surgeon General, just recently saying that due to the mental health crisis among young people, social media should come with a warning label. And I'm grossly paraphrasing that, but that's the headline. Anxiety is one of the biggest and fastest growing mental health issues our kids are experiencing, and it is beyond social media. I mean, they're under more pressure than many of us can imagine and relate to from the time when we were their age. I mean, take sports, for example, and the pressure to be a star. Not just try it out and be sort of okay and have some fun with your buddies, right? Kids are specializing younger than ever. And academically too, like gotta be good across the board. Something that came up though for me when I was listening to this episode again, and I can't help but feel like even that pressure in sports and academics and whatnot kind of does tie back to social media, right? That look at me, look at my kid culture. I don't know. I mean, it's just something that came up when I re-listened to this episode. Anxiety has been growing for years and then really was exacerbated by the pandemic. Rebecca Hoffman talks about that. She is such a great guest. She is the director of MaineHealth Center for Trauma, Resilience, and Innovation, and just shares some great insight. And she also knows what this is like to struggle with as a mom. So we're going to dive into the signs to watch out for, the importance of giving words to this feeling, and just as importantly, it's a conversation for us parents to know we are not alone. Rebecca, you say that anxiety in children is at an epidemic level. What exactly does that mean? And why should people who maybe don't even have kids with anxiety, why should we all be caring about this?
Anxiety has been at an epidemic level really for the past few years. It was on the increase prior to the pandemic, but since the pandemic, it has really exploded as an issue for kids really of all ages. I think that anxiety is at that epidemic level for a multitude of reasons, and I'll talk about a few. First off, the pressures on kids are bigger than they've been, right? I often think back to when I was a child, and if I wanted to try a sport, let's say I was in high school and I wanted to try a new sport, I tried a new sport. Now kids are expected to be specialized and really good at sports often before they enter middle school. That's true for music. That's true for other activities, is that the pressure to be good at things, whether it's because that'll give them a leg up with getting into college, or whether that's the expectation of the community they live in or the family they live in. There's a lot of pressure to succeed early on rather than just try. The idea of just trying something out to see if you like it is not accepted as it once was. That puts a huge amount of pressure on kids when they're at an age when they should be trying and making mistakes. That's how they're learning, right? Is to try and decide they don't like something and not do it anymore, or try and maybe not excel at it, so they try something else. So they're not getting that opportunity, or it's not as widely accepted. In addition, the academic pressures are greater than they have been as well. I think there's a lot of pressure put on schools to make sure kids are really excelling across all subjects, when again, kids don't learn by getting something right the first time. They learn by making a mistake and trying again. When you add in the pandemic to that, kids lost at least 2 years of normative social development. We don't really know what the impact of that is going to be because it's a new phenomenon to us all. And so what they lost, though, is that ability to interact with other kids on a regular basis and struggle with friendships, struggle with social situations. And so they're almost a couple years behind where the world expects them to be. And so for kids, that's feeling again like I'm behind. I have to catch up. I have to catch up in sports. I have to catch up in school. I have to catch up with social norms. And so what it's doing is putting incredible pressure on kids from a variety of angles.
I'm nodding my head. I'm feeling so many emotions when I'm listening to you, just having kids in that age. And it actually does make me emotional because I've seen it. And it's so hard to see them going through this. One thing, just even with the sports, I had that experience with my son who at 8, he's 11 now, wanted to try baseball. And we didn't know you had to start baseball at 4 years old. And so I started calling around and teams would not take him in the 8 to 10-year-old or whatever that level was. He would have to go back with 5 and 6-year-olds. And I was like, there's no way he's going to do that. So we ended up moving on and found another sport that he really liked. But that was really eye-opening to me that, it is sports, it is academics, it is the social nature, that these kids are growing up in such a different time. And one thing I think too is like for parents identifying what is, some anxiety around going to an event or a birthday party or a one-off kind of thing versus we actually might have a problem here. This is reoccurring. So how do we figure out the difference between those two things?
That's a great question. I like to think about it as the idea of stress, right? So when you think of stress, there's good types of stress, and then there are bad types of stress, which are really those types of toxic stress that overwhelm a child's ability to cope. And so let's say you have a 2-year-old who's trying to build some sort of a block structure together and it keeps falling over and they're getting frustrated, right? But that that's good for them, right? It's good for them to try, and stress, you can sort of think of that as kind of like anxiety. It's probably a little anxiety provoking for that child to try, fail, try again. And then what happens, they figure it out and they get that really good feeling inside them, like, I can do this. So if we think about stress and then we sort of think about anxiety along with stress, we want them to have some good anxiety provoking moments. So we want them to try, but we want them to have the ability to succeed. So the example that you gave about, let's say, a child being sort of quote unquote too old to a sport, which is really sad to me because like adults should be able to try new sports, but it's the way the world is now, right? You can't try something at 8 or 9. You have to already know how to do it. But if you didn't know how to do it, it's like you're out. But they almost don't have that ability to succeed at that, right? And so that's a kind of stress they're never going to have that ability to succeed. And so you found a way around it as a parent to try something else. But for that kid, you want anxiety provoking moments that can increase their opportunity to learn and succeed. And those are good for kids. Those are good types of stressors. Kids need to have what we call stress tolerance. They need to be able to tolerate difficult emotions in life. If they aren't given opportunities to tolerate difficult emotions, they grow up into adults that want to avoid anything difficult. And that's just not feasible in this world. And so your question about like what's too much sort of stress or anxiety and what's enough, I think that question is answered in a couple ways. First, you can answer it in, is this the kind of stress that's going to teach them and they're going to be better off in the long run for experiencing it? Or is this the type of stress that is just heading them down a path of pain and failure, right? And so that's one way to look at it. And sometimes that's not always clear, but just to try to simplify. But the biggest piece is in how they're functioning, how they're feeling, and how they're doing. And so if you have a child that is so anxious that they can't go to school, let's say, they are unable to perform daily activities like eat, sleep is a big one. If they're so anxious that they're not sleeping, when they're not sleeping, that's impacting their health. If they are so anxious that it's impacting their ability to do their schoolwork or perform well at school, if it's getting in their way of living, then that's something that requires additional supports, or it requires attention paid to it. If kids are saying, oh, I'm really worried, I have this big test, I'm nervous, I'm not going to do well at it, that's one of those moments as a parent when you could say, okay, well, what are we going to do about this, right? Like, you're going to study, you're going to prepare yourself, and that's a good thing, right? Because if they study and prepare, hopefully they'll do well and they'll build self-confidence. But now we're seeing anxiety where kids aren't able to function. They're not physically healthy. They get to the point where they also maybe get depressed, or they start pulling away from things that are normal in their life. They stop seeing friends. They stop going to school. Some kids, this is rare, but kids can go to the extreme of having images in their head that aren't really there, right? So it's kind of dissociating, and that can be a result of extreme anxiety. And so kids that are in those places where they are not functioning well, they need additional supports. They need to be seen by their PCP, their primary care provider. They need to be seeing a therapist or maybe getting medication. There needs to be some intervention to help them move through this anxiety. And the good news is there are so many treatments that are so good for anxiety and work really, really well.
I'd like to talk about some of those treatments. And before we get there, I kind of wonder, we've talked about a lot of outside causes of stress or of anxiety, the pressure, whether it's sports or academics or this just social and sort of coming in post-pandemic and not really knowing how to interact like you should at 8, 9, 10, 11, 15, whatever it might be. But is some of it genetic too, or is it primarily outside influences that might cause, a child to become anxious?
It's both or either. There's a predisposition potentially for anxiety. So some kids are just born with that mental health issue, and that will play out depending on their environment, right? So if they have a lot of stressors in their environment, you're going to see that anxiety play out. For a young kid, you might see a lot of finger chewing, and that's a very normal response to anxiety, but it tells you that there's potentially a child that might have some, like if someone chews their nails, that might be a kid that's more prone to anxiety. And as a parent, it's something you want to pay attention to. Or a child that's very nervous to go to school or go to sleepovers, like that's a child that might struggle with anxiety in their life. And that might be genetically just who they are. They have a predisposition to it, and then environmental factors bring it out. But then there's kids, for example, kids that have been exposed to trauma in their lives, like child abuse, like neglect, like exposure to domestic violence, and children that are facing major stressors like food insecurity or lack of housing. They have sort of an additional sort of layer on them that might cause more anxiety. They're sort of holding a lot more. And so it's kind of a mixture between both or either that can cause anxiety in kids. But what we are seeing is that there's this prevalence of it like there never has been before in history. And so those of us in the mental health field have to sort of say, or researchers like, why is that? And I think that's what's happening now is we're all saying, okay, something has changed, something is different. And we talked about some of those things, such as the pressures on kids in the world today. One that I didn't mention that I think we all know, but I just want to make sure it's out there is social media. And so the access to social media and the pressure that social media puts on children can be incredibly anxiety provoking. When you add that to the other pieces, then it's a lot that their little brains are being faced with.
And so it can cause anxiety for adults too. That's the reality. And as we talk about genetics, one thing that kind of comes to mind is because growing up, and I'm a Gen Xer, I don't remember these conversations happening at all. Is it possible that there was a lot of anxiety among maybe older millennials and Gen X when this was not as prevalent in the conversation? It was kind of more like, you'll be fine, you'll grow out of it kind of thing. And also, what is the impact of that we have this whole Gen X-ish type of generation? And again, I put some millennials in there too, that this was never part of the conversation or even addressed. So you probably had a lot of kids feeling anxiety or being in pain, and it just not being talked about, not being addressed, kind of a you'll be fine kind of attitude, right? It was a much different time.
Right. I think you're exactly right. I think kids were sort of pushed, you can do it. Just
rub
go.
some dirt on it. Yeah. You're good.
Exactly. Yeah. Brush yourself off and get back up. I think there is that piece that came from when we were children. I think it was underdiagnosed potentially. So it was thought to just be, I don't know, shyness. I often hear, that parents would say to kids, oh, you're just being oversensitive, right? Like that was often a thing that was said, you're just too sensitive. And that might have just been that child's tolerance for stress or anxiety was just like a little bit less than maybe another kid. And so you would see it more, it was more obvious that they were in distress. So I think there's a few factors there. I think that kids had to sort of suffer with it. And some kids suffered with it and they found the coping skills to be able to function with it. And some kids suffered with it and they didn't. They struggled into adulthood. One of the big fears that I have with kids in anxiety is that they're going to self-medicate their anxiety. So that's often what you will see is that there are substances out there that reduce those feelings of anxiety. There are drugs out there, recreational drugs that will reduce anxiety. And if a child or a teenager is riddled with anxiety, they're more likely to self-medicate for that. And so that's the risk, is that potentially some of those people are adults that, they were able to pull themselves up by the bootstraps and figure it out and do okay. And then there's some that are still suffering and don't have those coping skills, and their coping skills might be the use of substances or addiction.
Isn't that then why everybody should be caring about this? Drug addiction has very far-reaching consequences on so many different levels. And when we identify these kind of things in our kids, and maybe we're just getting a little concerned, right? Like seeing the nail biting or just struggling to get to school, some of those early signs that you mentioned, how do we talk to our kids about this? Like, how do we start those conversations in a healthy and productive way?
That's a great question. And I think the first thing I would say is that being able to give language to feelings is so important at a very early age. So kids can say, I feel angry. I feel sad. I feel worried. We need to teach kids that language because they don't have it naturally. And so we call that sort of social emotional learning. And so they need to know how to handle difficult emotions. And so they first need to learn how to identify emotions before they can learn how to manage those emotions. And we as parents can help them by, first of all, naming them ourselves, like, oh, it looks like you feel angry right now, or I see that you're feeling sad right now. When they're very young, you can start early on by naming emotions. And then they learn how to do that. And we celebrate that. Thank you for telling me that you feel angry right now. Let's work on a solution. So then they learn how to say the emotion. Then you help to teach them solutions. So it's not about not having emotion. I think that's what we learned as kids. Some of us is like, oh, we're not supposed to say those things or feel those things. But now we want kids to say them, talk about them, and we need to help them come up with solutions. So even in schools now, they're teaching kids from kindergarten up how to do this. And that didn't exist when we were kids. And they're offering kids solutions for when they're feeling mad, let's say, that doesn't involve hitting somebody or running out of the room, that they're really healthy solutions to emotions. And you can see as kids get that at home and they get that at school, how they're going to grow up and have a different set of tools in their toolbox that kids right now don't have, or kids didn't have when we were young.
I wondered, what about for the older kids? The preteen and teenagers aren't always receptive when mom or dad wants to have a conversation in this way. So how do you approach the older kids who you can tell they're feeling anxiety?
Yeah, and I can say I have a 12-year-old, so I'm in it right now of trying to help him to feel comfortable with those conversations. And we've been doing it his whole life. But now when someone becomes a preteen, it's like you're dealing with a whole different child altogether. So I think one of the best things to do is to model it, right? So to do it yourself. So to say, oh, I'm feeling really frustrated right now. And it shows them that this is a home where we give permission for emotions. And we all struggle. Even me as an adult is going to struggle with anxiety sometimes, or sadness or frustration. So you model it for them. And you make sure to give permission, even if they don't want to talk to you about it, that you are a safe space for those emotions, right? So you model it, you say, you may not want to talk about this, but I want you to know that I am here and I will sit and listen if you want to talk. And then also just sort of like surveillance, making sure they do have places to go, whether it's good friends or mentors, coaches, teachers, where they were really struggling, that they have a safe place to go. And then even beyond that is mental health treatment. Like at some point for some kids, they are going to need additional supports. And it isn't because they necessarily aren't getting it at home or they aren't getting it at school. It's just for whatever reason, they're going to need some skills that therapists know to manage anxiety.
There are a number of different types of treatment. And before we get into that phase of treatment, I just wondered a little bit about being at home and when it comes to that feared activity, whatever it is, if that's the way that anxiety is manifesting for your child, whether it's they don't want to go to school or there's something about sleepovers. What is the level where you push, but you got to face your fears? There's that, but also trying to be empathetic and understanding and not wanting to put them in an uncomfortable situation. So where's the line when it comes to pushing forward so that you can see you do not have anything to be afraid of when it comes to whatever activity, and saying, you know what, I get it. I see that you're hurting. This is very scary. Let's just take one step. That's a tough one to navigate, especially as they get older, because it's very hard to force a teenager or even a pre-teenager to do something they don't want to do.
I would say that is definitely sort of one of the parenting $1 million questions, right? Is do we force them to do it, or do we listen to what they're expressing and say, okay, obviously my caveat is every child's different, every parent's different, every situation is different. So there's no easy answer. What I have done as a therapist and a parent with therapist knowledge is to first talk it out. If this is something you really don't want to do anymore, we need to sit down and talk about it. And so it's not going to be a yes or no. I'm going to hear you out. I'm going to hear your reasons why you don't want to do something. And I need to flesh out as a parent why that is. So is it an activity where they're getting made fun of because they're not good at it or they're new to it? So they're getting bullied, which is something that needs to be addressed immediately. Bullying is so damaging to kids. Is it because they just don't like it? Is it because it's anxiety provoking because there's a lot of pressure involved? So really like to flesh out the reasons why they don't want to do it. If you have a child that's prone to anxiety, you might be having this conversation over and over again, because any new thing is anxiety provoking.
With Walmart's new fresh and frozen subscriptions, you can save time on your weekly grocery shopping.
Dad, you're supposed to be grocery shopping.
And miss the chance to embarrass you in front of your friends? I subscribe to snacks and wet napkins. You know how messy you are.
Dad.
Walmart. Subscribe to your weekly list.
One of the ways I like to think about it is sort of how do we preempt that or get ahead of it? And so if you have a child with anxiety, you might be having that conversation a little bit down the road upfront before they do that activity. Sort of set the parameters like, this is going to be new and it might be hard that it's new. What are we going to do if it feels uncomfortable? So you have sort of your toolkit ready for like, okay, I might hear, no, I don't want to do this anymore. This is how I said I was going to respond to that. And this is how we're going to respond. So you have a very predictable response, which feels safe to kids. So you want to increase their feelings of safety. So when you're talking to them and you sense like they don't feel safe, and I use the term safe, not like physically safe, but like it's provoking their anxiety reaction. What are some tools that can help it? So how about we meet with the coach and talk with the coach? Sometimes what I find one of the best ways is I carpool with other kids, and just the connection of other kids going to the event will bring my child to want to do it more. I found being like, hey, how about I drive a few of the kids? So I think there's ways to try to troubleshoot before we just say, no, we're not going to do this. But if it's so anxiety provoking for a child that it's causing them a lot of distress, then we as parents need to listen to that. So what I'd say is kids need to learn, we stick to something, right? We say we're going to do it, we stick to it. But if they try something and they've tried lots of different tactics to make it work, and it's still not enjoyable and anxiety provoking, or it's not what they thought it was going to be, sometimes what I would recommend is make an agreement with them. Say, okay, you want to choose to quit. I want you to quit on, your bad day. I want you to quit after you win the game. And then if you still want to quit after you win the game, then I will let you quit. So let them quit at a high moment and see if they still want to at that point. Or say, okay, I'm going to let you stop doing this, but as an agreement, I want you to do this instead.
Like try a new sport or try it. Yeah, that makes sense.
For my own kids, it's like my fear is I don't want them to not want to do stuff because they want to just sit at home, right? So, okay, if you don't want to do this, that's fine, but we're going to do this instead. And sometimes you can flesh out some of those reasons to not do something that aren't as helpful. And really, if it's really anxiety, then you're going to keep seeing this again and again, and you're going to know that's, your child's going to need some additional supports to help them get themselves out there and try new things.
So what would be the first step in getting treatment if we feel like this is where we are? And what are the treatment options in general? Like would be, some of the key treatment options that would be available to kids?
So there are a lot of options. Luckily, anxiety is a widely treated issue, and most all therapists have been trained to treat it well. There's the treatment model that many people have heard of. Cognitive behavioral therapy works wonderfully for anxiety. First step, I would say, is to talk to your primary care provider. Let them know your concerns because they're often the bridge to treatment. Many primary care providers have therapists in the primary care office that can see kids or adults, depending, on where you go, for short-term issues like this. Anxiety can be treated in the short term. It doesn't have to be a lifetime of therapy. And so that would be a good first step. Other steps are to be, if you have a therapist, a child therapist that you know and that you trust, connect directly with them for treatment. The other reason why it's important to connect with your primary care or your child's primary care provider or pediatrician is that there are circumstances when medications might be helpful. And there are medications that are very helpful for kids with anxiety if it's not, can be treated just with talk therapy or play therapy. And so if that's the case, you want to get your pediatrician or primary care provider into the conversation early on.
Is there a way to prevent this?
It's a great question. I think the answer is yes and no. There's always going to be things in our world that are anxiety provoking. I mean, think of us as adults. They're like around us all the time, right? There's things that are anxiety provoking. So you're never going to have an anxiety-free world. Treating anxiety as a mental health disorder, you're going to see forms that come from genetics, and those you can't necessarily avoid. There's going to be forms of anxiety that come from being exposed to trauma. So if we could eliminate childhood exposure to trauma, which would be incredible, then you would eliminate a lot of the anxiety that's out there in kids. But what we can do, and where I think we can focus our energy, is teaching ourselves as adults and teaching kids the tools to manage distress. So what is our stress tolerance? And increasing our kids' ability to manage stressful situations, because that's going to serve them their whole life.
If there was one thing that we could do today to help ourselves, help our kids, or just help our kids, what would that one thing be?
The one thing I would say is that we need to show kids that it's okay to have difficult emotions. And by doing that ourselves and facing our own difficult emotions, we're going to teach kids that it's okay for them to have it and that they will get through it. I think when you see adults avoiding difficult emotions or not wanting to feel them and trying to push them down, you're going to get kids doing that too. So our lives are filled with difficult times and filled with difficult emotions. And we want to teach kids that they will get through that. And so we need to model that for them.
Rebecca, thank you so much. I want to make sure that our listeners know we will have many more resources on WGME.com/raisingme. I can't thank you enough for your time and your expertise today. And I really hope we helped a lot of people.
Definitely. Thank you so much, Adrienne.
Rebecca left us with so many important things to think about. And what kept coming up in our conversation, what I have kept top of mind since our chat, is the importance of naming difficult emotions, allowing and supporting difficult emotions, processing difficult emotions, not just for our kids, ourselves too. That's not always easy. I totally get that, especially for those of us who didn't necessarily talk about that kind of thing growing up. Also, we've talked about giving ourselves grace in prior episodes. How about making an effort to give our kids a little grace? There is so much pressure on them from so many directions, too. I mean, let's just start with the pandemic and the social developmental delays there as a whole. Rebecca talked about that. Yet, as a society, we still expect them to act their age, so to speak. And there's sports and the pressure to be better younger. There's social media and all the comparison with that. And school, that is more competitive than ever. Speaking as somebody with a high schooler, it is so beyond academics, especially if you're thinking about college and you're in that phase. It's, what are you doing to better the community? Plus play a sport at a high level, be in a club. Oh, and are you in advanced courses? And you should probably have a job. So I'm actually doing a self-check more often and easing up at least a little bit. Most of all, if you're struggling to figure this out, know that you are not alone. There is help. And the most important thing that we can do is to get it when we realize our children need it. Thank you so much for being a part of this conversation. I'm Adrienne Stein. This episode is edited by Megan Littlefield. Please take a moment to follow Raising Me wherever you get your podcasts. Of course, a positive rating and review also helps others find this message, so we really appreciate that. Wherever you are, I hope you learned something new and get to take a little time for you.